How effective is SLT? Though SLT is not a new technology, it has attracted a lot of attention recently because of the LIGHT trial. The LIGHT study is a randomized controlled trial which randomized more than 700 patients to receive initial laser or initial glaucoma medical therapy. The primary outcome was health-related quality of life at 3 years, measured with the EQ-5D questionnaire. Secondary outcomes were cost-effectiveness, disease-specific health-related quality of life, clinical effectiveness, and safety. What are the clinical benefits of offering SLT as a first-line treatment? Glaucoma progressed in a lower proportion of patients in the laser first versus the medicine first arm. Over 36 months, IOP control was better in the laser first arm, with more visits at target IOP, a lower number of glaucoma medications, and no glaucoma surgeries. Patient non-compliance with topical glaucoma therapy may partially explain these results, and there may also be less diurnal IOP fluctuation after SLT compared with medications. Remarkably, 3/4 of patients in the laser first arm were medication-free at 36 months. Hence, in our editorial in I, we recommended the SLT should be offered as an alternative to medications as a first-line treatment for newly diagnosed POAG. Is repeat SLT effective? In a follow-up paper on the LIGHT trial, about 2/3 of eyes which underwent repeat SLT were medication-free at 18 months. These results demonstrate that SLT can potentially maintain IOP at or below target IOP with at least an equivalent duration of effect to the initial laser. However, the LIGHT study only included treatment-naive glaucoma patients who were predominantly Caucasian. The LIGHT in China study is currently underway, and the results will reveal whether similarly good results are seen for Asian patients. The efficacy and predictability of SLT was more variable in other real-world studies, highlighting that patient selection is important. There are less data on the clinical outcome of SLT in medically uncontrolled glaucoma, normal tension glaucoma, and secondary glaucoma, and the efficacy is likely lower in these contexts. Some studies have shown that patients with fewer pre-laser glaucoma medications experience greater IOP reductions with SLT. A couple of studies also found that the efficacy of SLT decreases with concomitant prostaglandins. This patient of mine would be an ideal candidate for SLT. Newly diagnosed early glaucoma in the left eye, baseline IOP of 26, and after SLT, the IOP was 18 at 6 months on no medications. Patient selection is important for SLT, and it seems to work best in the context of treatment-naive patients or those with mild to moderate glaucoma on few medications. How safe is SLT as a primary procedure? The rate of SLT-related adverse events was low in the LIGHT study, with IOP spike occurring in only 1% of patients who underwent SLT. This is lower than that reported in other SLT studies and could be because performing SLT at an earlier stage of the disease may reduce the incidence of SLT-related complications. Though the LIGHT study has shown that SLT has a good safety profile, other studies have shown a higher incidence of IOP spike, especially in eyes with heavily pigmented trabecular meshwork. Hence, be cautious when performing SLT on such patients. Corneal edema, peripheral anterior synechiae, and macular edema have also been reported. Does SLT improve the quality of life? In the light study, there was no significant difference between the treatment arms when assessed with the EQ5D questionnaire. But this questionnaire has a low sensitivity for ophthalmology, especially for glaucoma, which is often asymptomatic. However, the laser first arm had better scores for the glaucoma symptom scale, which incorporates measures related to the side effects of glaucoma medications. What are the economic benefits of SLT as a first-line treatment? The laser-first approach resulted in overall cost savings of £451 per patient for the NHS, with a significant reduction in the cost of surgery and glaucoma medications. Initial SLT was more cost-effective than initial medical treatment over a 3-year period in the NHS setting. SLT has also been shown to be cost-effective in the Canadian healthcare system. However, the cost-effectiveness of SLT may differ in various reimbursement environments, and it may be particularly favorable in countries where branded rather than generic glaucoma eye drops are used. Besides considering the cost-effectiveness of SLT from the patient's perspective, another practical consideration is the cost-effectiveness of SLT for a glaucoma practice. So I recently set up my own clinic, which is a very exciting new venture for me, and I wanted to get an SLT machine. There are quite a few SLT machines to choose from, and it is much more cost-effective to have an SLT machine which also has the YC function. Hence, your choice of SLT machine may also depend on how good the YC function is. The laser machine I have in my clinic is the Nidec YC-200 S+, and I'm going to digress a little from SLT and share a bit about the YC function of this machine. I really like performing YC capsulotomy with this machine because it has a low plasma threshold, which means that the energy is delivered very precisely, and I found that it was less likely to cause IOL pitting compared to some of the other YC machines I have used. I've also liked that the aiming beam had 2 rather than 4 dots, which makes it easier to focus, and the aiming beam can also be rotated to avoid any corneal irregularities. Besides posterior capsulotomy, I've also used this machine to perform anterior capsulotomy for eyes with an anterior pupillary membrane. The YC laser is precise, and it cleanly cleaves the membrane without causing any iritis, which could cause the membrane to recur. So when starting your own private practice, just as I've done, you might also want to consider investing in a laser machine which has multiple functions, such as an SLT machine, which also has a good YC capability. In summary, SLT is an effective, safe, and cost-effective first-line treatment for newly diagnosed and treatment-naive POAG. And secondly, patient selection is important for the success of SLT. Thank you very much for your attention.